More vaccines will be going into more arms sooner. The Ford government now says anyone over 18 will be able to book a shot by the week of May 24th.
This is exciting news. The way out of the pandemic is vaccines, and the light at the end of the tunnel grows brighter every day.
More vaccines arriving and steadier supply means the Ford government is accelerating its vaccine timeline. As of next week, starting May 3rd, all adults over 50, as well as those 18 and up in hotspots and people with high-risk health conditions, can sign up for a vaccine. The week of May 10th, the age drops to 40 and up. By the week of May 17th, it's 30 and up. And the week of May 24th, it's 18 and up. After that, 16 and 17-year-olds will be considered. The government is also allocating 50% of vaccine supply to hotspot communities for 2 weeks, starting this Monday.
An increased supply of vaccines mean we will not be taking away vaccines from other public health regions.
More than 5 million doses have been administered, with 38.5% of adults in Ontario jabbed with at least one dose. The government is on track to keep its promise of vaccinating 40% of adults with at least one shot by May 1st.
There's clear reason for hope, but this hope requires a commitment, a dead-set determination to see the job through.
This comes as the latest modeling presents a somewhat more encouraging scenario. It finds cases are flattening, but at a high level, and stresses the need for caution. ICUs are still under tremendous pressure. Younger, healthier people are dying, and clearing the surgical backlog of more than 257,000 cases will be an enormous challenge. Variants make up more than 90% of cases, and there is no sign of anything reopening soon.
When we can reopen, when we hit that level where we can think about reopening, schools, and then I expect sort of outdoor activities would be top of the list.
Now, a couple of really interesting things came out of that modeling update. Dr. Adelstein Brown, who's on the science advisory table, made it very clear the table isn't entirely aligned with the Ford government. Again, for example, he'd like to see 50% of vaccines going to hotspots for 4 weeks, not the 2 weeks the government announced today. And when he was asked point blank if the government's 3 paid sick days leave plan is compatible with the best case scenario for controlling COVID, he answered with one word: no.